On the occasion of the World Hepatitis Day, we are trying to give you a brief overlay of about various kinds of hepatitis and jaundice. Myself, I am Dr. Poorna Chandra. I am a consultant gastroenterologist and hepatologist practicing at Fortis Bannerghatta Road and at Poorna Clinic in JP Nagar in Bangalore. As we all know, jaundice is usually characterized as presence of yellowish discoloration of the eye with yellowish discoloration of the urine. This may be usually associated with lack of appetite, a vomiting sensation called as nausea, vomiting, diffuse body pains called as myalgia, and joint pains. So the jaundice can occur because of various reasons. This jaundice can be because of causes related to the liver or maybe non-liver related causes. In the non-related liver-related causes, which are classically called as pre-hepatic and post-hepatic causes of jaundice, the reason is usually because of excessive destruction of RBCs, that is the red blood cells, which may occur because of infections or toxins in the blood or because of certain deficiencies of hormones. The post-hepatic causes are usually where there is a blockage in the flow of the bile, and this blockage itself can result in jaundice. While today we are more interested in looking at the hepatic causes of jaundice, which are broadly medically classified as hepatitis. Now, hepatitis can be because of infections, which could be because of viruses, bacteria, tuberculosis, or it could be non-infectious in the form that it could be because of some toxins, like the most common being the alcohol, some drugs, and also because of reduced blood supply. On this day, we are more interested in looking at the viruses which principally cause hepatitis. They are the hepatitis B and C, and the others being the hepatitis A and E. The viruses causing hepatitis are principally of two types: those which are acquired because of contaminated food and water, called as the enteric type of hepatitis, which are the hepatitis A and E, and those which are acquired through either contaminated blood and blood products or through sexual relationships, which are called as non-enteric type, which are the hepatitis B and the hepatitis C. Most of these enteric type of hepatitis, that is the hepatitis A and hepatitis B, are self-limited. They are usually the hepatitis A usually occurs in children, while E is more common across the age groups. They may occur in epidemics in the sense that a large number of people in a community may be affected by it, and are usually associated with fever, loss of appetite, body pains, aches, later on going on to develop jaundice, which usually subsides by itself by taking rest and good amount of nutrition. They are usually not associated with any lasting problems and are usually non-fatal. The rare causes of these hepatitis A and E becoming dangerous or causing life-threatening problems are when this infection occurs over an underlying liver disease or in cases of pregnant females. The other variety of hepatitis are the hepatitis B and C, which are called as the non-enteric and are non-associated with the food and water related transmission. These usually occur because of contaminated blood or blood products and are also spread by non-healthy sexual relationships. Here, the acute component of hepatitis is very rare and they usually linger on and cause chronic injury, which is usually manifested by various forms of liver dysfunction, notably development of fluid in the body called as ascites, swelling of the limbs called pleatal edema, jaundice. Some people may develop bigger veins in the intestines which can bleed on to death, and altered sensorium where a person may appear confused, agitated. This are the symptoms of a prolongedly injured liver, which then undergoes decompensation. These two kinds of hepatitis are also one of the main causes for liver cancer. So they usually start off with acute, which is usually not recognized, and go on to develop chronicity. Now, what we need to understand is people are usually very afraid when they hear that they have hepatitis B or hepatitis C. The course of hepatitis B usually runs over years, not over days. So, if you get hepatitis today, the damage is slow and ongoing and usually takes over decades before the liver becomes permanently damaged. So whenever somebody gets to know that they are hepatitis, there are reasonable tests to find out at what stage is their infection and at what stage is their liver dysfunction. Based on these, there are effective treatment modalities which can control and help stabilize the liver. So When somebody gets to know that they are either infected by either hepatitis B or C, they should consult their physician, get the required evaluation, and if required, started on specific treatment. Now, adherence to treatment is very essential in these cases, because an improper treatment leads to resistance, which makes the virus resistant to all available drugs as of now. Hepatitis B is classically treated with oral medicines, while hepatitis C is uses a combination of injections and medicines. Treatment usually lasts anywhere between 6 months to years, depending on various factors. Now, having said this, the most important aspect of hepatitis is prevention, and prevention is quite easy here. While the enteral type of hepatitis can easily be prevented by following good personal as well as food hygiene. So you can have, if you are able to wash your hands before each meals, take good hygiene with respect to the vegetables, food and utensils, you are more or less protected against hepatitis A and E. While in case of hepatitis B, you have a very effective vaccination available. There are 3 doses of this vaccine which can be given anytime after birth at intervals of 1 month and 6 months from the starting dose, which gives very effective immunity. While hepatitis C has no such vaccination as of now, and the prevention is by following good practices like not sharing needle sticks, not coming in contact with contaminated blood, and if at all any blood transfusion or any surgery is required, to get themselves pre-tested. It is also prudent to practice good sexual precautions and follow a monogamous relationship. In addition to this, there are vaccines available for hepatitis A and E, which are also very effective. As of now, hepatitis B is a hepatitis B vaccination is a universal vaccine, and it is one of the first vaccines which can prevent a cancer. So I would advocate everybody to get themselves tested, and if negative, go for a complete set of vaccination. As of now, there is no much evidence to suggest regular boosters, so one set of vaccination will give you protection throughout the life. With all this, the most important thing is to have good personal hygiene, food hygiene and sexual hygiene, and be protected against these viruses. Thank you.